Good morning. Over the next several weeks, we expect to see our vaccine allotment increase substantially. In St. Louis County, we're currently using all 3 FDA-approved vaccines. To prepare for the vaccine surge, we will need more volunteers to help us. So today, I'm calling on primary care physicians and other medical providers in St. Louis County to consider becoming a vaccinator. As a patient's most trusted source of information on vaccines, you play a critical role in helping build confidence and getting the COVID-19 vaccination distributed widely throughout the county. It will take all of us, the Department of Health, pharmacies, hospitals, and physicians working together to meet the demand for the vaccine. And those relationships are already in place. We just need to build on them. Providers who want to participate as a vaccination site can enroll through Show Me Vax, a system set up by the state of Missouri. The Missouri Bureau of Immunizations has developed helpful tools to guide you through the COVID-19 vaccinator enrollment process, including provider enrollment FAQs, a provider enrollment checklist, and the provider enrollment training guide. If you are interested in signing up to become a local vaccinator, please visit stlcorona.com/vaccinators. This week, our Department of Public Health is aiming for a record 15,000 vaccinations, and we're putting on more events than ever to meet the demand for COVID-19 vaccines in our community. These efforts involve multiple strategies, including the vaccination event in St. Louis County for educators on Tuesday and Wednesday at Florissant Valley Community College, and large-scale vaccination events like the one Friday and Saturday at Queenie Park. We are also actively working with several of our community partners to get our homebound residents and those living in senior group homes the vaccine. The mix of outreach is critical, and it comes with an extraordinary effort and coordination. Thank you to the hundreds of volunteers who have been dedicating their time and skills to the cause. We are grateful for your service to our community. With the number of vaccines delivered to our community expected to dramatically increase over the next several weeks, we will be holding more large-scale vaccination events and will need more volunteers. Please consider helping us meet this need by becoming a volunteer at future events. You do not need to have a medical background or training to help. We need volunteers in a variety of roles to make this work. There are clinical roles such as vaccinator or post-shot monitor and even clinical oversight. But we also need help in non-clinical roles such as supply staff, registration, greeter, usher, scheduler, data entry, and line monitor. If you're interested in volunteering, visit stlcorona.com/volunteer. We're getting more shots in arms every day, and I love hearing the often emotional stories that come with sitting down in the chair and rolling up a sleeve. We will soon receive more federal funds to help us continue our response to the pandemic, and these funds will help us complete the vaccination process. They will help us continue to assist struggling families with basic needs, and they will help us get our economy not only fully restored, but more robust than ever. We cannot have a healthy economy without healthy residents, and we cannot let up on our year-long effort to protect ourselves and our loved ones. If you have not yet registered to be vaccinated, please do, either through St. Louis County, the state, or through a hospital system. Several registrations are fine, but please only accept one appointment. Those in Phase 2 will be eligible for a vaccine a week from today, on Monday, March 29th, and everyone will be eligible on April 9th. As we work to get through the vaccination process, please continue to practice the public health protocols that have proven to help slow down the spread of this virus. Wash your hands frequently and thoroughly, avoid crowds, and keep wearing that mask. Thank you, and I'd be happy to answer any questions.
Dr. Page, we have a couple of questions regarding mass vaccination sites. One is from Channel 4 about when will there be a mass vaccination site in South County?
Yes, well, we're certainly all frustrated by the vaccine supply for St. Louis County and the St. Louis region, and the disparity that we all had to live with at the beginning of this process. We're watching vaccine pre-registration very closely, and we are concerned about the low pre-registration rates and the limited access to transportation in North County, and have focused a lot of our effort, a great deal of our effort there. Watching the pre-registration zip code maps, we have pretty good pre-registration uptake in South County, except for a couple of zip codes a little bit west. And we believe the Queenie Park site is a pretty good location. It's a large facility that's owned by St. Louis County, and that will help address some of those pre-registration disparities in the south part of the county. We also recognize that our partnership with Melville and Afton fire departments has helped us deliver a great deal of vaccine through the Public Health Department to South County. And those vaccination sites have been ongoing for 2 months. And we vaccinate more people each week in those 2 vaccination sites in South County than we could at a mass vaccination event on a weekend.
And this is a related question, but are there plans to open more mass vaccination sites, not just in North County, but throughout St. Louis County?
Yeah, the mass vaccination sites, a question about mass vaccination sites and plans for more. We certainly are looking at more mass vaccination sites, but really the best way to get more people vaccinated is to have more and more and more small sites, to have more vaccinators, more pharmacies, more doctors' offices, more partners in the community, vaccinating a few hundred people every day, hundreds of vaccination sites vaccinating a few hundred people, then one location vaccinating 2,000 on a Saturday. So the mass vaccination sites are helpful, but as the vaccine supply becomes more available in St. Louis County, we really need to see a whole lot of vaccinators, hundreds of vaccinators, doing a modest amount of vaccine every day, and that's how we'll get people vaccinated. But we will certainly be, we'll certainly see more mass vaccination sites as the vaccine becomes more available, and as we're able to get vaccine here in St. Louis County. We know the supply remains limited as of today.
That's all the questions we have.
Okay, thank you.